And we go to slide where we can see the form that the doctor completes just while the patient is presenting a complaint. And so we've listened almost everything, but so we didn't listen to the end of the story. Have we completed anything here? Any gaps in this form? So who has completed?
All of it?
Will you repeat, please?
We will complete all of it, all of them.
You should complete all of them, yeah. And how much have you already done?
I did 11. I'm not sure one of them.
Okay, so, and I see. So we need to listen now. So now I am turning it on and we'll listen up to the end.
Two. Good morning, Mr. Bloomfield.
Can you hear now?
Yes.
Good.
Listening to. Good morning, Mr. Bloomfield. My name's Dr. Dixon. I'm a locum GP standing in for Dr. Wright. What can we do for you?
I've been having some problems with my breathing.
Can you tell me a little bit more about this?
Well, I keep getting breathlessness and wheezing in my chest. It all started about 3 weeks ago, and I've been coughing a lot with it. Some white phlegm. I thought it might be a cold coming on, but then after about another week, I started finding it more and more difficult to catch my breath.
Right. So you've had the wheezing and the breathlessness for roughly 3 weeks?
Yes, give or take a day.
And do you get these bouts of wheezing and shortness of breath every day?
No, they come and go.
How frequently do you get them?
The first week there was only one, I think. And then they started getting worse, 3-4 times a week. It's not being able to get my breath that's really worrying.
And so the attacks, have they increased in the past 2 weeks?
Yes, they're much more frequent.
Okay. When do the attacks come on?
At any time, but they seem to be worse at night and in the morning.
Have you noticed any change in the severity of the attacks, especially in the morning?
Yeah,
Do they wake you up at night?
about 3 times a week.
I see. You been off work at all?
No, but I nearly didn't go in yesterday.
Was that the worst so far?
Yeah.
And have you had anything else with it?
I've felt a bit tight across the chest.
Any pain with it?
No, just tightness.
Are you aware of anything that triggers the attacks?
Like what?
Dust, feathers, new carpets?
No, I can't really say I am.
Okay. Have you had any infections recently, like flu or sore throat or chest infection?
No, not for a long time, except this.
And what about medications? Are you taking anything?
No,
No aspirin?
no,
Are you doing any exercise? Jogging, for instance?
no.
What about pets? Do you have pets at home?
No, but my neighbours have a cat, but I don't see it that much.
Everything okay at home?
Yeah, things are fine.
And what about work? I see you're a civil servant. Any stress or problems at work or anything like that?
Work's been getting me down recently.
In what way?
Well, there's been a lot of changes going on recently, and I suppose I'm a bit anxious, what with the mortgage and that.
And this has been getting to you?
Yes, more and more.
I see. And does the wheezing, etc., continue over the weekends?
No. When I come to think about it, it doesn't.
Okay. Some general questions. Have you ever had anything like this before?
No, never.
Do you have other illnesses? High blood pressure, diabetes, or heart problems?
No, nothing like that. This is the first time I've been ill in my life.
Has anyone in your family had anything similar?
No, not as far as I know.
What about eczema? Anyone in your family with that?
Both my sister and my mother have it.
Well, now let us check what we've written. And Zena, please. In the first, at the beginning, in number 1. Zena?
Yes, yes. I think breathlessness
Mhm. Breathlessness.
and wheezing.
And wheezing, okay. And in number 3 and 4, Alia, what is missing here? Alia, hello, where are you? So Alia is not here. So Dilara,
Yeah.
so what did you write in number 3?
Yes.
So
Cog.
productive what?
Cog.
Cough, okay, productive cough.
you hear
With
me? And
with white
4 is flame.
phlegm. Mhm. By the
White
way,
phlegm.
so here on the first line, 3 out of 52. What does it mean? What do these numbers mean? Alia, do you understand? So the patient was speaking about what? The doctor asked him for how long he has had these kind of symptoms, yes? And the patient answered it was 3 weeks, for 3 weeks. Mhm. Now the history of presenting complaint. Let us listen to Bere.
Can you hear me or not?
Yes.
Because
What's your name?
it's cutting off.
Sorry.
Hello. Are you Bere?
No, I'm Ala. I was talking, but you couldn't hear me.
Yes, I didn't. Alia, so what about number 5, Alia?
Me, Naima.
Alia, please. Hello. Are you here?
Yes. Can you
Yes.
hear me?
What did you? Yes, I can hear you. What did you write in number 5, Alia?
At night,
At night, and number 6. What was it?
in the morning.
In the morning, yes. So the text got worse at night and in the morning. Now let us look at the next line with number 7 and listen to Bere. Bere, hello. Are you here?
Yes, I am here.
Yes.
3 weeks.
Number 7. What did you write?
3 weeks.
3 times a week. Yes.
Yes.
Weeks.
8 tightness.
Mhm. Are the symptoms chest tightness? Okay. And thank you, Bere. Ezginur, what about number 9? So contributory causes. No.
Number 9, I don't know, but
Mhm.
I say 10.
Then what is 10 then?
Asthma.
Yes, asthma. Mhm. Actually, number 9 is no known precipitants. When the doctor asked about the triggers of this condition, and they discussed the pets, dust, anything. So no known precipitants of this condition. Now, post-medical history number 11. Let us listen to Buse. What did you write in 11 line? Buse?
11, I write illness attack, all previous attack.
No history of previous attacks.
Attack.
Okay. And in the last line here, this is about the family history. Mustafa, can you tell us what is missing in line 12? Mustafa? Mustafa is absent. Minus. Ceren,
I'm here.
you
I'm
are
here.
here. So
Yes.
can you
It's
answer my
eczema.
question, Mustafa?
Eczema.
Eczema, you are right. Yes. So this is what the patient's mother and sister have, this kind of disease. And the question, what is the differential diagnosis as future doctors? What do you think? So you've listened to the description of a lot of symptoms and signs, so the condition. And what is the disease? Jerian, what do you think? Jerian, hello. Are you here? Yes, she's coming. Maybe Mohammad Wahesh can answer about the diagnosis. Is Muhammad here? So what about Zena?
Yes, I'm here.
So any ideas?
differential- I think it's a method, like in healthcare, they use it to analyze the patient's history and like joining physical examination to arrive at the correct diagnosis.
And what is it? The diagnosis, what is it?
I don't know actually. But since like the mother and sister has eczema.
Maybe yes. So this is
maybe, but like I think it affected the mother and the sister's disorder affected him, but it might be not the same diagnosis.
But this is one of the first ideas that come to us when we listen to this patient, right? Okay.
Yes.
So so the patient was speaking about the signs and symptoms, and let us just look at the meaning of these words. Sign is an indication of illness that the doctor sees, but not the patient. It is not apparent to the patient. So, and a symptom is what the patient notices himself or herself. Sometimes signs can be classified as symptoms and vice versa. It's not just, we can't differentiate between them. If we have a look at the following slide, so we should decide whether these are signs or symptoms. Some of them can be both. So these are the signs and symptoms of one condition. So let us listen to Alia. Will you please read the lines and say whether they are signs or symptoms?
Okay. Blocked nose is a sign. Raised temperature is a symptom. Tender over, or should I only answer one or all of them?
All of them, yes.
Okay. Tender over sinuses, I think it's a sign. Headache worse on bending is a, no, actually, headache worse on bending, it's a sign, and the runny nose is a symptom.
Okay, so one more time. So sign, what the patient doesn't see, the doctor just understands this and symptom. This is obvious to the patient, right? So, blocked nose, headache on bending, runny nose, they are mostly symptoms, yes? Sometimes the patient doesn't understand, so these doesn't see this tenderness over the sinuses or the temperature. It can be a sign, but anyway, he can feel it, and in this way, this is the symptom. And condition B, let us just also comment on this. Signs and symptoms, and divide them into signs and symptoms. Dilara, please.
Yes, raised pulse is a symptom. And vomiting, there sign, I think.
Okay.
Dehydration is a symptom. And abdominal tenderness is a symptom also. Cramping abdominal pain, sign, maybe.
Mm-hmm. So if we move to the next slide, this is, so the signs, I don't agree that vomiting and diarrhea is a sign. It's a symptom, just because the patient can feel and see this, but maybe dehydration is not so obvious. Okay, and now if we have a look at the pictures, the question is which diseases are signs and symptoms might relate to. So the condition A, so we remember that that was blocked nose, raised temperature, tender over sinuses, headache, and runny nose. So what is the disease?
Maybe
will you repeat, please?
fever.
Blocked nose.
Yes, so
Maybe sign of
vomiting.
Okay, it can be sinusitis, okay. Or it can be just a flu, infectious disease. Yes, or no, just cold. And okay, and condition B, vomiting, dehydration, abdominal tenderness, abdominal pain in the second picture. So what kind of disease is it?
Can you show the signs and symptoms again, please?
Can't be poisoning.
Poisoning, yeah, okay.
can be asthma.
Sorry?
Asthma.
Or crampy abdominal pain.
Okay, and so this is like gastritis, right? So just a lot of, yes?
Maybe pregnancy, I think.
Sorry, pregnancy?
Maybe.
So I don't think it's about this picture. Okay, but conditions, okay, yes. Yes, possible. Well, let us go on and pneumonia. Okay, non-technical language. Let us just, we were speaking once about this, that we should, doctors should use the common words just so that the patient can understand them. So you need to use non-technical language and look at the two example questions from the case history. So which verb means precipitate and which verb means start? So the doctor asked, when do the attacks come on? Is it precipitate or start?
Start.
Okay. And are you aware of anything that triggers the attacks? here?
It's precipitate.
Precipitate, that something that goes before the text. So these phrases are everyday just phrases that are used. They are non-technical words. And now let us have a look at the task here, the exercise. We should replace the technical words. They are given in each sentence in italics. So, and we should replace them with one of the non-technical words which are given to the right in the column. And so you may have to change the form of the word. For example, if we have a look at the first sentence, let us listen to Dilara, please. Dilara, hello.
Yes.
Read number 1, please.
Okay. We are going to have to perform a FIV test.
So you see that the word which is in italics, this is perform. And so which non-technical word should be used here instead of perform? What do we do with the tests? Any ideas? So is it avoided, meet, have, prone, do?
Maybe 3 all time.
Maybe what? Sorry? 3 all time?
Maybe there all time.
We are going to have 2, 3 all time, a few tests. I think it's better to choose a verb because they all the time. It's not a verb. There is no verb here in this phrase.
Do.
Exactly, you are right. We are going to have to do some. Have to do a few tests. Okay. So please let us just do it individually and just 2 minutes to you to complete the sentences. Please write and then we'll check. Start please now. Well, so let us read the sentences and Mohammad Wahish. Sentence number 2, please. Mohammad is absent, I see. Okay. Zena, please, the second sentence.
She's suffering from a very bad bout of flu. I think prone. Suitable
word. What about choosing another word?
Or maybe you can also say she has got.
She has got a very bad flu.
Sorry, I thought just the word suffering.
I see. Okay. Instead of suffering, we should use have or has got. Yes.
Yeah, I thought we should just replace the word suffering. Yeah, if it's suffering from, we can just change it that she has got a very bad bout of flu.
Okay, yes. Thank you. So, Alia. Alia, hello.
Yes.
Yes, so sentence 3, please. It is for you.
It might be a good idea to refrain from fatty foods for a while. Refrain is like avoid.
Avoid fatty foods for a while, okay? So, Dilara.
Yes, you said the coke is intermittent. Comes
Sorry?
comes and goes.
Number 4, please, Dilara.
Oh, sorry. He's susceptible to many minor illnesses. Prone.
He's prone to many minor illnesses. So then, Bere.
Yes. 5, right?
Right.
You said COVID and the intermittent.
Yes. The cough is not constant. So you said the cough.
I think.
It's not all the time.
Yes.
If it is not all the time, if it is intermittent, so the patient doesn't understand this intermittent. So which phrase is better to use, which can replace intermittent? So who can help us?
Comes and go.
Yes, so the cough comes and goes. Okay. Yes, thank you, Bere. And now Ezginur. What about number 6?
Your cough is persistent.
So this is the opposite.
There all the time.
There all the time, you are right. Okay, Buse now, please. The 7.
It is difficult to adhere to any kind of life change. The admit, I think.
That here.
Or adopt.
No. It's difficult to. We have already used avoid. It's. Let us think.
I think admit.
No, admit. Admit is. Admit. Okay. So here it's difficult to admit. It's better to use stick to. It's difficult to stick to any kind of life change. And Mustafa. Mustafa, hello.
You won't have to be hospitalized. It's
yes, hospitalized when a patient comes to a hospital and so the people,
admitted.
yes, so you won't have to be admitted. And the last one is for Jiren. Number 9, please. Jiren? Jiren Efe. Hello, are you here? No reply. So Zena, please.
Yes, you're scheduled to see the nurse in the allergy clinic next Tuesday. I think it's maybe the word book.
Yes, so to book means to order something, yeah? So, and you are booked to see the nurse.
Yeah, you're booked to see the nurse.
Okay, so let us move to the next slide. And non-technical language. So I don't think we can do this now, but okay. So It means we should use the phrases to make questions with non-technical words and role play a patient with flu or a cough. It means that there is a conversation between a doctor and the patient, and the doctor asks question beginning with when, is there, do you, did you, have you ever, and so on. For example, are you prone to, are you booked to see, do you find it difficult to stick to medication? Does your cough come and go? Have you ever had? I mean, the same words that we used in the sentences on the previous slide. And so that the patient can easily understand the doctor. Who would like to be a doctor in this conversation? Doctors, would you like to be a doctor? Can we ask Dilara, for example? Dilara, hello.
I
Dilara?
don't mind.
Sorry?
I don't mind too. I'm Zena.
Okay, so Dilara will be a doctor and the patient with flu and cough. So who would like to be this patient?
Doctor, I was talking, not Dilara. I'm Zena.
Zena will be a doctor, yes, and Dilara will be a patient, right? Dilara, are you here?
Sorry, bad connection.
So are you here now? Do you hear?
Yes.
Okay,
Now.
so please, doctor, and interview your patient. Ask your patient the questions. Start, please. Zena?
Should I start with the word when?
So you see the patient for the first time. So what should you say to the patient?
When did the symptoms begin?
Yesterday.
Okay. Is there any medications you took?
No.
Do you have any wait, do you have any allergy? Maybe?
Yes, there is a bee.
Sorry?
Bee allergy.
Did you wait? Let me think about the question. Did you drink any cold drinks, for example?
Yes, maybe Nurofen.
Have you ever wait, or are you? Should I stick to these words or can I like?
No. So these are some examples of such questions. You may ask your own.
Is it severe or normal cough?
I think normal cough.
Okay. When does it occur? At what time, especially in your day?
Dilara.
Three times. 2 or 3 times.
Okay. What more question? Do you have sore throat?
In the day.
Wait, I asked this question. How long did the symptoms
Yes.
or for how long?
1 day.
Occur?
1 day.
All night?
Yeah.
Okay. I'm gonna prescribe medicine for you. You can take it once before your meals, and the checkup is going to be after a week.
Right.
Okay.
Thanks for your.
Great,
You're welcome.
ladies. So very typical conversation when and I see that the doctor just tried to use the Socrates model, just asking questions that we were speaking about the location and severity and everything. Yes, sometimes the patients are difficult people, yes, because they are sick, and so it's hard for them to answer the questions, and they suffer from pain. Well, good. And so it is time to pause our class